This short video aims to explain how to monitor compartment pressures using arterial line monitoring equipment and an anaesthetic machine. Compartment syndrome is usually a clinical diagnosis, and in certain cases no investigations are required and the patient can proceed to theatre for immediate fasciotomy. In uncertain cases or with an obtunded patient, you may need to monitor compartment pressures. Commercially available compartment pressure monitors are portable bedside tests that are straightforward to use. However, if these are unavailable, you may need to use an anaesthetic machine and arterial line monitoring equipment to measure pressure. A lack of familiarity with the setup would be awkward in a clinical setting, but potentially quite embarrassing in a viva session of your exam. The equipment required to monitor compartment pressures include a pressure bag, a 1 litre bag of saline, a central venous pressure kit including a transducer, and a cable to connect that kit to an anaesthetic monitor. In this video, an arterial catheter is shown, however we would recommend the use of an 18 gauge or green Venflon. Because an anaesthetic monitor is required, an ODP is desirable. Insert your litre of saline into the pressure bag, secure it and then hang it on a drip stand. Using the attached hand pump, inflate the pressure bag until the valve underneath shows a green stripe indicating that adequate pressure has been achieved. Once the green stripe is visible, the adequate pressure achieved, lock the hand pump from the pressure bag. At this point, it is important to prime the system, ensuring that all air bubbles are removed by pulling the blue toggle on the transducer to allow saline to flow through. Any air, bubbles or blood may affect the reliability of the pressure reading. The transducer should then be positioned at the same level as the limb in which the compartment pressure will be monitored. Otherwise, artificially high or low values may result. The anaesthetic machine is then set to monitor for central venous pressure by changing the pressure settings. This allows the next step to be performed, which is the zeroing of the system. To select the CVP setting, scroll to the area on the monitor that deals with pressure and then down to Label. Change this setting from arterial to CVP. This gives suitable pressure ranges for dealing with compartment pressure. It is possible using this screen to set up an alarm above which a pressure would alert the clinician, and this could be useful in continuous monitoring. The next step is to zero the system, calibrating it so that the initial value is 0 millimeters of mercury. This is done by turning the switch on the transducer so that it is off towards the patient or pointing towards the line that will be inserted into the patient. Then going back to the anaesthetic monitor, where using the scroll wheel you can select the pressure area of the screen and then select 0 CVP to zero and calibrate your setup. Please note that during zeroing, the white lever on the transducer should be toward the patient, and then after zeroing has been completed, turn the lever as shown towards the sampling port. The word OFF is written on the white lever and should be pointed towards the patient during zeroing. At this stage, either a Venflon or an arterial cannula, as shown here, can be used to measure the compartment pressure. The needle and tubing should initially be primed with saline, and the needle inserted perpendicular to the skin in the area of interest and directly into the compartment. If a Seldinger technique is used as shown here, only a short passage of the wire is required. If a Venflon is used, the needle and cannula is passed through the skin before the needle is removed. Once the cannula is inserted through the skin and into the compartment, a guide wire, if necessary, is removed and the cannula is connected to the transducer tubing. At this point there is no need to change the lever on the transducer. Attention can then be turned back to the anaesthetic machine, which now shows the compartment pressure. Values from other compartments can be obtained by repeating the process, or the catheter left in place for continuous monitoring.